Good evening, North Carolina, and welcome to tonight's episode of PA Alexa's Medical Skill of the Day. Good evening, folks. Tonight we're going to talk about nasogastric tube insertion, which is a hollow tube which we pass from the nose through the esophagus and into the stomach. This is a widely used and extremely useful procedure, so let's get started. Indications for nasogastric tube insertion include sampling gastric contents, removing air, blood, ingested substances, and gastric contents, and providing nutritional support for patients who cannot eat but have a functional GI tract. As we've discussed before, it's always important to consider the contraindications before beginning any medical procedure. The most important contraindication for nasogastric tube insertion is significant facial or basilar skull trauma or fracture. Other contraindications include esophageal stricture, atresia, or burn, choanal atresia, Zenker diverticulum, recent surgery on the esophagus or stomach, and history of gastrectomy or bariatric surgery. Potential complications include trauma, hemorrhage, and erosion of the affected structures from the nose to the stomach, aspiration pneumonia, sinusitis, and misplacing the NG tube into the trachea and lung, causing pneumonia or pneumothorax. Before beginning your procedure, be sure to verify that you have all of the necessary materials, including non-sterile procedure gloves, goggles, and gown, portable or wall suction equipment, hypoallergenic tape, an occlusive seal dressing, or a pre-manufactured NG tube holder, an emesis basin, a cup of water and straw, your stethoscope, a 20 to 60 milliliter irrigation syringe with an irrigation tip, 100 milliliters of water for irrigation, towels to protect the patient, and the appropriate size and type of NG tube. And now we're ready to get started. Always be sure to discuss any procedure with your patient and answer any questions that they may have before beginning. First, ensure the patient is sitting in a 45-degree angle or greater. Ensure that you have all of your necessary materials and that you've washed your hands and put on your gloves, goggles, and gown. Place a protective sheet in place over the patient's chest and abdomen. Check for nasal patency and examine each nasal passageway. Choose the most patent nostril for tube placement. Then, using the tube to be inserted, measure from the tip of the nose to the earlobe, from the earlobe to the xiphoid, to determine the appropriate tube insertion length and distance. Be sure to mark the tube. Lubricate the first 2 to 3 inches of the tube with lidocaine jelly lubricant, and ensure that the beveled opening of the tube is positioned toward the nasal septum to avoid trauma. Have the patient flex his or her neck towards the chest, and slowly and gently insert the tube into the nostril straight back at a 90-degree angle. Have the patient begin taking small sips of water and swallow as you gently advance the tube. When you reach the mark on the tape, stop. Then, inject approximately 10 milliliters of air through the tube while listening over the left upper quadrant of the abdomen with your stethoscope. You should hear a rush of air. And finally, the gold standard to confirm proper NG tube placement is with an upright chest x-ray. And now, as an exciting treat, we will watch a real NG tube insertion. That's it for tonight's episode. And as always, stay healthy, North Carolina.